Hi, now welcome back to the Men's Health Hub. Today we're going to be talking about atherosclerosis, and really there's a lot of overlap between diabetes and hypertension, but atherosclerosis is the buildup of fatty plaques and calcium deposits on or within the artery walls. And to some extent it's a natural part of aging, but there are factors that can dramatically increase the risk or tendency to narrowing of these arteries, and they include first and foremost smoking, high cholesterol levels, diabetes, poor diet, obesity, and hypertension or lack of exercise. Now, like many other health problems, it's likely that some of us are more prone to this problem than others, and it's down to genetics that we have inherited. Intermittent claudation is a manifestation of atherosclerosis. So this is whenever they are narrowed for a short period of time, where the arteries become narrowed and the blood flow is reduced, and that can affect an individual whenever they do exercise. It can cause a lack of oxygen to the calf muscles and it causes pain. And that pain will characteristically stop whenever the person stops exercising. So if you've heard of angina, you will understand intermittent claudation fairly well. The difference being that in angina, it's the arteries that take the blood to the heart muscle which are narrowed, whereas intermittent claudication is whenever it's happening to other muscles in your body. Strictly speaking, there is no scientific evidence that herbs can reverse the narrowing of the arteries, but this is mainly because there's not been much research into the herbs and how they might be used. However, there's a lot that can be done to minimize the process and alleviate the condition. So exercise is crucial as it helps to maintain blood flow, and there's been many research trials showing the benefits of ongoing exercise in the condition. Discuss with an exercise program assistant with your GP and ask about exercises or referral schemes in your area where you can access well-supervised programs for free or at a reduced rate. You want to stop smoking immediately. Smoking is by far and away the biggest risk factor. You want to get your cholesterol reading under control. Now that can be done by diet and lifestyle changes as opposed to doing it by statins. But if the reading is very high, you may be asked to take medication. It's up to you as to whether or not you're going to do that. You want to get your blood pressure under control too, and you want to ensure that your diet is high in veg, at least 5 to 10 portions a day. Low in animal fat, but really healthy fats are important. And you want to get enough omega-3 essential fatty acids found in fish, flax, or hemp seed. There's some evidence that vitamins and minerals have a tendency to reduce atherosclerosis, to stop the blood from becoming too sticky. And there's been interest in the benefits of folic acid recently. This is found naturally in fruit and veg, but if it's taken as a supplement, it's always best in a B vitamin supplement rather than on its own. There's some evidence that vitamins and minerals have a tendency to reduce atherosclerosis, to stop the blood from becoming too sticky. And there's been interest in the benefits of folic acid recently. This is found naturally in fruit and veg, but if it's taken as a supplement, it's always best in a B vitamin supplement rather than on its own. Have raw garlic and onion daily because it's wonderful for atherosclerosis and for the vascular system in general. And then last but not least, keep stress to a minimum because adrenaline can raise cortisol and cholesterol levels and your blood pressure. So keep a positive outlook on life and remind yourself that this is a condition that responds very well to lifestyle changes. And last but not least, keep stress to a minimum as adrenaline can raise cholesterol levels and blood pressure. Keep a positive outlook and remind yourself that this is a condition that responds very well to lifestyle changes. Now, herbally, hawthorn and lime flower are traditional remedies with a reputation for helping to dissolve fatty plaques due to their strong antioxidant properties. They also help to keep the arteries dilated, and these herbs are taken over a long period of time. They're circulatory herbs that can help, such as prickly ash, ginkgo, ginger, and rosemary to help maintain healthy blood flow. Valerian and cranberry bark are excellent for dilating the arteries, which can help with high blood pressure and act as relaxing remedies. You just need to keep a check of any contraindications with any herbs or medicine that you're on. And I think that's it for now. So it goes very much hand in hand with what you would see in the diabetes and the cardiovascular disease. This is just a quick synopsis of atherosclerosis in case that's a diagnosis that you've been given. All right. Cheers.